Welcome to our first Faith Network Lunch and Learn of 2021. And today we're going to be talking about informed decision making and the distribution of the COVID-19 vaccines. For those of you who are not aware of the Faith Network, or this is your first time joining us, the Faith Network is a group of places of worship, researchers, and health organizations that are committed to improving the health of our community by engaging with our faith communities. And so we do a lot of work on making sure that we're providing accurate information about health concerns and doing things to decrease health disparities here in Arkansas. So without any further delay, we're going to get straight to it. And I'm going to introduce our moderator for today, Camille Hart.
All right, good afternoon, everybody. Thank you for joining us today. Like Dr. Haynes said, we are going to be talking about informed decision-making around the vaccine and the distribution of the COVID-19 vaccine. So the Faith Network, we have been having, not just the Faith Network, but also with a project called Rejoice, we've been having conversations with pastors about COVID-19, and some things they've been asking us, like, what can I tell my congregation and other people in my community about the vaccine or about COVID-19 and how to take care of themselves, and what can I do to better serve my people around this area? And, as a response to that, we wanted to provide back some information for them that they were requesting. Let me just give a shameless plug real quick. If you are a pastor out there, we are looking to talk to more pastors about COVID-19. All you gotta do is just give me a call at 501-444-2133 or send me an email at chart@ums.edu, and we would love to talk to you about this subject. Back to what we're here today about. So today we are going to talk about that. We have three great panelists, and I'm going to let them introduce themselves, and I'm going to go by an alphabetical order by last name. So I'm going to start off with Dr. Battle.
Hey, good afternoon. My name is Dr. Marlene Battle. I'm a native of Eudora, Arkansas. I attended the University of Arkansas for Medical Sciences, where I received my doctorate of pharmacy degree, and I also have a master's of science in biology from the Texas A&M University Commerce location. And I'm excited to be here with you all today.
Thank you for agreeing to be with us. Dr. Canterbury.
Hey, good afternoon. My name is Dr. DeLon Canterbury. I am a clinical pharmacist as well and CEO and president of Geriatrics. It is a medication management company where I focus on saving you money and reducing healthcare costs. Really excited to be here today. I've been currently residing in Durham, North Carolina as a part of the Durham Minority COVID Task Force here.
Thank you. And Dr. Dillahay.
Hi, I'm Dr. Jennifer Dillahay. I'm the state epidemiologist and the medical director for immunizations and outbreak response at the Arkansas Department of Health. And I grew up in Little Rock, and I trained at UAMS. I trained in infectious diseases and geriatric medicine. And I've been at the health department for 20 years now. So, and it's my job, is to help with the COVID outbreak and the immunization program.
Thank you. So as you all see, we have a panel of experts who know what they are talking about regarding this topic. During this, we will be taking questions from the audience. But we have some specific questions going to reach out first, and then we'll take questions. If you have questions, just please put those in the chat box, and we will get to them if we can. Okay. So I just want to get started off with the first question. We need to know, we know about COVID. COVID-19 is only affecting us here in the state of Arkansas, but it's affecting the whole world. We've all heard that the vaccines are out, but some of us may not know, what is the vaccine? What is the vaccine, and what is the vaccine specifically about COVID-19, and how does it protect us from COVID-19?
Do you want me to start?
Sure.
Okay. So there's two vaccines that are available to us right now, the Pfizer vaccine and the Moderna vaccine, and they both work the same way. They're both what we call mRNA vaccines, and that really basically provides the person getting the vaccine with the genetic material from the virus that codes just for the protein on the surface of the virus. So it doesn't have the whole virus in it, and it doesn't have all the other genetic material. It just codes for that one protein. So when you get your shot, the mRNA goes into the muscle cells, and the muscle cells make that protein just like it would if it had gotten infected by the virus. But it hasn't, there's no virus there, and all the other parts of the virus cannot be made. It's just that one protein. And this is the protein that the immune system learns to recognize. And so when the cells make that protein based on the mRNA, the immune system learns to recognize that protein, and it's not supposed to be there, and the immune system knows it, so it develops an immune response to it by making, one of the things it does, it makes antibodies, which are proteins that the immune system makes that hook on to proteins that aren't supposed to be there. And so these antibodies hook onto the spike protein, block it from being able to attach to cells and invade and infect them. So it works really well. The vaccines that have been made are 95% effective in completely preventing people from getting the illness. And in the studies, they were 100% effective in keeping people from getting severe COVID disease. So they're really great, and they've been proven to be very safe.
That was a very thorough but good explanation of how the vaccine works. Thank you for that. Did anyone else have something they want to add?
No, I think she made a great point of pretty much identifying that you're not getting a live virus. A lot of my patients tend to ask, hey, am I getting the virus? Will it change my DNA? The vaccines basically are creating a cheat code to allow your body to remember how to fight off the next time it sees it again. So that's how I try to have people see it, just like how you may get a flu shot or a pneumonia shot. You kind of want to see it in that level of how it's protecting your body from the next time it sees the COVID virus. And so now it remembers how to fight it off and hopefully prevent those severe symptoms that put you on a ventilator.
I think it's important to know that there's no live virus in it. It can't give you COVID-19. And the mRNA in the vaccine that goes in the cell doesn't stay around very long. And it can't change your DNA, and it stops making the protein because it gets degraded pretty quickly. And so it only makes the protein for a very short period of time, and then that's it. But the immune system has learned to recognize the protein and remembers it.
Okay. Y'all hit on some other questions that I had later on. So that's good. That means you are giving us all the details. The question that we have, I want to talk about, if you can answer this, Dr. Dillahay mentioned that there are currently 2 vaccines that are out. What are they, and what are the differences in the makeup of the vaccines?
Okay, so there are 2 vaccines, and it is the Moderna and Pfizer vaccines, and they both are the mRNA vaccines. Just a difference on them is Pfizer would be approved for ages 16 and up. Moderna is approved for ages 18 and up. Both of the vaccines have over 90% efficacy in preventing the virus. For the Pfizer virus, if you receive the second dose, you would come back in about 21 days. For the Moderna, you would come back in within 28 days after receiving your first dose. Also, it's just important to note on those that whatever brand you're receiving, so if you receive the Pfizer brand for your first dose, then it's recommended that you would also receive that as your second dose as well. And then as far as the Pfizer, then it would need to be diluted and mixed with normal saline before you would give that injection, whereas your Moderna vaccine is already ready to be administered.
One thing I'll add is, and this is something that we're hearing a lot of in the news, is requiring super, super cold temperatures for that Pfizer vaccine. And that's the one that really a lot of labs and maybe academic hospitals may have, so they can house the vaccine. In some of the more rural settings, it's almost more likely that you will find the Moderna vaccine because it doesn't require those super cold temperatures, and it's unfortunately leading to probably some of the bottlenecks we're seeing in getting the vaccines out faster. So you will find Moderna a bit more in those more remote independent pharmacy settings, and then maybe in more populated areas like around health systems, you'll find Pfizer. The keynote is there really are no difference. If you have a chance to get it, just get it. Too many people are dying as it is, and they both have been shown to have over a 90% success rate in preventing that severe illness from happening. So it's such a remarkable thing. I mean, the data, the clinical trials on these vaccines are almost stronger than some of the stuff I see for current medicines to date. So I use that as a comparator because we take all types of medicines now, but we're not really questioning the evidence behind it. We just kind of take it. These trials have shown to be almost better than some of the stuff we're using today in practice.
Okay. Another question has come up that ties into like the vaccines and the types that there are. Someone asked, what about the Johnson & Johnson vaccine?
Yeah, I could speak to that. So we are still waiting on a couple more vaccines to come out. Johnson & Johnson is a really hot topic right now, and that's primarily because it's a one-shot shot. You don't have to do it, 3 weeks, 4 weeks out. It doesn't require those super cold temperatures like Pfizer does. And currently, we don't know the exact numbers on it like we do for Pfizer and Moderna. So we are actually hoping to have some evidence come out this week, if not next week, from Johnson & Johnson. And hopefully we'll find out more information about some of the others that are out there, like Novavax and AstraZeneca as well. So there are more coming. It's just we're still waiting patiently for that evidence.
Okay, great. Let's see. So who should get the vaccine?
Well, I can start with that. As Dr. Battle already said, the Pfizer vaccine is authorized for people who are 16 and older, and the Moderna vaccine 18 and older. But then it comes down to how we're going to distribute the vaccine right now, and who should get it. It's recommended for anyone in those age groups if they don't have an allergy that would keep them from getting it. So what we're doing in Arkansas, because we don't have enough doses for everyone, is we're focusing on vaccinating certain groups. So right now, the groups that we're focusing on vaccinating are people who are 70 and older, because we know that the older we are, the more likely we are to have severe disease. And then we're also focusing on people who work in the education sector. That would include preschool or daycare, K through 12, colleges and universities, and adult education. And the reason we're focusing on those workers is because those people are key to keeping our schools open and helping our communities and our society function as normally as possible in this pandemic. So right now, that's who should be getting the vaccine. And then over time, we'll move on to different groups. And we're working now to identify those groups and get the news out so people will know what to expect.
Okay. We'll talk about like the people who will be getting it in the future. Will the vaccine be available for children to get it?
Well, there are clinical studies going on right now to test how well the vaccine works in children as well as its safety for them. So over time, the intention is for children to be vaccinated, but the studies haven't been completed yet.
Right. I mean, at least we could have some peace of mind with 16-year-olds and up with Pfizer. But that goes the same as well for pregnancy and lactation. That I get that question a lot as well, is it safe for them? And we are still studying trials and data for that. But overall, the reception is to still consider getting a COVID vaccine if you are pregnant or breastfeeding.
Okay. And I can attest to that as well. We've had gynecologists that have recommended pregnant women to go ahead and do get the vaccine. And also, just as a side note, as if a person that would not be able to receive the vaccine is if you just have had some kind of severe reaction before, maybe to an injectable drug, that we would take that into consideration, or if you are allergic to a certain ingredient within a vaccine, then it may not be recommended for you to receive it.
Great point.
So if I get the vaccine, is that going to prevent me from getting the virus?
Most likely. Now, some people will get the virus between doses because the first one dose is not enough, not as good as 2 doses. And it takes a couple of weeks after the second dose. But the studies show that about 94 or 95% of people, so that means out of 100 people who get the vaccines, 94 or 95 of them will be completely prevented from getting COVID-19. The other 5 or 6 out of that 100 will possibly get COVID-19, but they'll have a mild case. And so the vaccine will prevent 100 out of 100 people from getting severe disease. Now, and those vaccines were tested in people who are pretty healthy. If someone has a weakened immune system, they may not have as robust response to the vaccine. So they should keep that in mind when they get vaccinated. However, getting vaccinated is more likely to help them than not getting vaccinated. So we do encourage people, even with weakened immune systems, to get vaccinated.
Okay.
Absolutely agree. We just have to keep advising for now that we just keep seeing the worst effects of people that aren't vaccinated, and the risk of death is there, and it does depend what your other conditions you may have. So even those who may be autoimmune disorders, it's something I want to emphasize. You have a candid conversation with your provider and really get the fine picture of what's best for you. I feel they'll most likely say to consider getting it either way, but that's a conversation you want to definitely have with your doctor before making that decision as well.
So, like I said previously, we've had a discussion. I want you to learn about, dealing with the stigma of having COVID, and so we know some people out in the community have had to deal with getting the virus. So if I've already had COVID-19, do I still need to get the vaccine?
Yes, you do. And I can personally attest to that again. I myself have had the COVID-19 virus. I had it back in November. And I have received the COVID vaccine, both of my doses since then. So it is still recommended that you do get vaccinated. And the question I commonly get is, well, what is the time frame between having the virus and, and then receiving a vaccine? And so according to the CDC, they recommend that as long as a person has, met the isolation requirements and that they're not displaying the symptoms, then it would be okay for them to go ahead and get the vaccine. I think some research may be showing that you may still have the antibodies in your system for about up to 3 months, and you guys can correct me if I'm wrong on that. But outside of that, then it would be, okay for you to it is still recommended for you to go ahead and get the vaccine.
Okay.
Yeah, it's thought that people who had the illness, COVID-19, have some immune protection for a while. We're uncertain how long that lasts, but generally people think it's about 90 days. So some people may wish to wait and get vaccinated and allow, since there's not many doses around, and let other people get those doses since they have some protection. But I would encourage people just to go ahead and get vaccinated. When you have a chance to get vaccinated, don't waste it. Get vaccinated now, but there's not enough vaccine for everyone. And so if you have a chance to do it, it's your turn, get vaccinated.
I just want to reiterate what Dr. Canterbury said. If you have a current condition, you should just talk to your provider to get their feedback on you getting the vaccine. Like you said, they'll probably tell you do need to get the vaccine, but you should talk to your provider first. Okay, so if I do get the vaccine, what should I expect after getting it? What should I expect in the short term? What kind of side effects should I expect? And in the long term, what side effects should I be looking out for?
Yeah, so easily the most common question I get. So generally, and it varies from person to person, but you can expect to feel a little bit of flu-like symptoms. So having a fever, having some soreness, having some definite muscle soreness at the site of injection. You also may have, basically some chills. You may have, a little bit of fatigue. In fact, fatigue has probably been more common than some of the other ones I mentioned. So you're gonna feel a little bit out of it. And that's worst case scenario, okay? This is not every patient. I've had the vaccine myself. I had muscle soreness for 2 days, ended up still being able to work out. And I also have vaccinated over 100 people who've gotten the vaccine. We had them wait for 30 minutes, 15 minutes after, and no one had any immediate side effects I can speak to. So the worst case scenario, think of side effects that may be similar to you getting a flu shot or you getting a pneumonia shot, where you may feel a little bit out of it, you feel a little off for a day or two, but honestly, by that third day, those symptoms should be gone. And it may vary for those who may be, autoimmune compromised or may have a weakened immune system.
Okay, so I've gotten the vaccine and I'm feeling good. My arm's a little bit sore. Is it okay for now for me to go visit my family members that I've been avoiding because I was scared of either getting COVID for them or giving them COVID?
Well, let me say that the recommendations haven't changed yet. So we want people to get the vaccine and hope for the future. They need to make sure they've gotten both doses and have waited a couple of weeks before they make changes in what they do. But right now, we are still recommending that people wear face masks and they practice social distancing and avoid crowds and wash their hands often, just like before. We know that some people who get the vaccine can still get COVID-19. And we also know that, or actually what we don't quite know yet, and we're still trying to learn more about, is to what degree do people who get the vaccine, are they able to carry the virus and shed it or spread it without getting sick themselves? We think that that's probably not a great risk, but we don't yet have all the studies and the data completed to know for sure in order to be able to make a change in the recommendations. We do hope that that information will be available soon and we can make recommendations for changing, but right now it's too soon. We don't know enough yet.
Okay. So the safest bet is to continue doing what we've been doing. So,
right, for now, yes.
So wear your mask, social distance, wash your hands.
Yeah, I mean, getting the vaccine is not, I am completely in the clear now. Let me go travel to the islands. It doesn't work that way. You can still get the virus, you can still spread, even though it may be less likely, like Dr. Dillaha said, it can happen. And we all are hurting and we want to see our loved ones and kind of see our family and relatives. It's still too much of a high risk. Community risk of spread is high. You can literally get the vaccine and then go to your grocery store and get it that day. We don't know. So that's why the CDC and this new administration is really pressing to keep the social distancing measures, the washing your hands, the, making sure you decontaminate areas that may be commonly used in your home, just to stay safe. And that's what we have to do with the vaccines in order to beat this.
So, and let me add too that it's important to get both doses, even if you have side effects that are unpleasant, because I can tell you the COVID-19 can be really unpleasant. But so the Pfizer vaccine, as Dr. Battle mentioned, there's a minimum of 21 days between the doses. So you don't want to get it before 21 days, but after, and you want to get it as close to 21 days as you can. The CDC says the evidence is good that it still works well even within 6 weeks, but you want to get it as close to 21 days. And then the same thing with the Moderna vaccine. The minimum time between the first and the second doses of the Moderna vaccine is 28 days. So as soon after 28 days, you can get vaccinated. That's what you should do. Up to 6 weeks afterwards is still good. but you want to get that immunity established as soon as possible. So we do encourage people when they get their first dose, make their appointment for their second dose and keep it, stay on track, get vaccinated.
And when you do receive the vaccination, you'll also receive a vaccine card. And we've been writing, you know, the date of the first dose. And then on the back of the card, we'll put the date that you should come back for your second dose. So we're proactively taking measures to make sure that people will come back in for their second doses. And with my patients, not only will I put it on the card, but I also make a phone call just to remind them and say, hey, you're coming back in on this date at such and such a time, just to make sure that we do encourage people to come back and get your second dose so you can be in that 90% effective rate.
Thank you for that.
Also, I was going to just add one thing. There is actually a side effect tracker once you get the vaccine. So once you get vaccinated, you get your card, there's an app that you can download called vSafe. It lets you report any symptoms you have. It's through a really cool, easy to use app. It's going straight to the CDC, and they're tracking everyone's side effects so that we can have an objective lens, if they report it, on what the bigger symptoms are. And honestly, if people were dying left and right from the vaccine, this would be all over the news right now. So I'm glad that we're doing our due diligence and really looking at those side effects after people get the vaccine. So you're not just left stranded on what to do.
Yeah.
Well, I'm glad you brought up vSafe. So if I've gotten my shot, so I've gotten the COVID-19 shot and I signed up for vSafe, and they send me a text message once a day. I get things like 3 or 4 days following the shot.
Mm-hmm.
So why is it important for me to keep giving them this information back? Like, if it's not bothering me, why should I put this in?
I think one of the things is we know from the clinical studies that a certain proportion of people will have local symptoms, soreness, redness where they got their shot. They may have some lymphadenopathy or swollen lymph nodes in the area. And some people will have systemic symptoms like fever, headache, chills, fatigue. And then some people, it's rare, will have an allergic reaction. And the CDC wants to know about all of that to see how common it is, but especially the rare things that happen, because if they enroll 40, 50, or 60,000 people in the clinical trial to study the safety, if there is a rare side effect that hasn't been noted before, say it occurs in one out of every 100,000 people, well, it might not show up in the clinical trial that they did because that only had 50 or 60,000 people in it. So that really helps them identify things that they should look for and be aware of. And if there is something new that shows up, they'll be sure and catch it early. So that's why we want people, even if it's fine, if you're fine, that helps them know, give them an idea of, you know, the proportion of people that have nothing that happens, and then a portion of people that have some side effect.
And it's really easy to sign up for it. I do it, help patients during their observation period of a 15 or 30-minute time frame. If they'll just take out their phones, there's a little barcode that you would be able to scan and just pull it up. And it just takes a couple minutes just to even get it set up and register. So I try to help my patients do that as well.
So I mentioned, like, it's important to get the follow-up shot for the vaccine. But what if it's difficult to get that appointment? And especially in that time frame, need to, what should people do if they're having a hard time getting an appointment to get that second vaccine?
Well, they should contact the provider that gave them the vaccine, the first dose, and follow up with them, because they're the ones that are going to receive the second dose for them. And they're supposed to hold those doses. And so that's who you want to contact and follow up with.
Yeah, at least in North Carolina, people who got the first dose are already booked for the second dose. So they're reserving them for those patients already. So I would hate for anyone to deal with not being able to find it. But VSafe also allows you to kind of have a reminder set up through the app. So it tells you when you're due for that next dose, in addition to you having your card. But you definitely want to contact the initial provider that gave you that first dose.
So want to make sure that we get to conversation about the distribution of the vaccine also. But we have, please keep sending your questions. We'll try to get to them. But even before we get there, I want to talk about, there's been talk about the lack of trust of the medical field by some Americans, specifically Black Americans, because historically their trust has been violated. For example, because of the Tuskegee experiment, or even more recently, Dr. Susan Moore and the treatment that she got after having COVID and the treatment she got in the hospital. And so we were like, why should people trust the medical professionals and the government about being vaccinated for COVID-19?
Well, let me start about this. I think, one of the concerns that a lot of people have about being vaccinated is they're worried about the safety of the vaccines, and they don't trust the studies, and they fear they're being experimented on. And many people talk about the Tuskegee experiments, which historically were just, I don't even have words to describe how awful it was what they did. But sometimes people don't really understand what happened in Tuskegee. People have the misimpression that unproven therapies were tried out on these men in Tuskegee, when in reality, what happened was proven effective treatment for syphilis was withheld from these men so they could study what happened in the absence of treatment, which I think was just really egregious. So now when research is done, everybody has to give informed consent, and they have to be given detailed information about what they are about to engage in or receive, and they have to give their permission. And that was, I guess, the good thing if that came out of Tuskegee. So now when you receive your vaccine, you're given a detailed paper about the vaccine so you can review it and make an informed decision. What concerns me, though, is because people don't know what happened at Tuskegee, they think that an unproven treatment was given to people rather than a proven treatment was withheld. So they choose not to get the vaccine because they think it might be an unproven treatment. And the great irony is that it's proven to be safe and effective. And if they don't receive the vaccine, they may be withholding the vaccine from themselves, which is very ironic, in my opinion. So I do encourage people to be very well informed about Tuskegee, what happened, to be well informed about these vaccines, so that out of fear of repeating Tuskegee, they themselves don't withhold a safe and effective vaccine from themselves. There's good information out there that they can use to make an informed decision. And by making an informed decision for themselves, to me, that is the redemption of Tuskegee. And I hope people will do that. They will take the opportunity and not go to social media for the information. You do not want a doctor to make recommendations based on what's posted in social media. And you probably shouldn't be making decisions for yourself based on what's posted in social media. We encourage you to go to the facts and learn where you can get them. The CDC has very accurate information about the vaccines on their website. It's cdc.gov. And the Food and Drug Administration has very good information, accurate information on their website, and that's fda.gov.
Anyone else want to add anything to that?
I think she nailed it, honestly. And what I tend to say when people bring up Tuskegee is I try to break down exactly what Tuskegee was, and she completely described it perfectly. It was refusing a treatment that could have been treated, okay? We have to get that covered because people think, oh, they gave you the, no, that's not what happened. But this is how I put things in perspective when people bring up Tuskegee. I implore people to ask themselves, how many people do you know have had COVID? You know, I have people usually raise their hands, we're all virtual, but think about it. How many do you know have had COVID? And then I go further and ask, how many do you know have been hospitalized or died who has COVID? And then I ask you, how many people do you know with facts have died from the vaccine? And a lot of people cannot answer that last one. And that we have already vaccinated close to 22, 23 million people. One of the founders of vaccinations back in the early 80s, 90s, well, not then, but one of the more leading prominent figures in making vaccines says that once you hit your 3 million mark of people vaccinated and not many people have grown heads or new legs or whatever, it's almost safe to assume it's safe. Now, we can't say that definitively, but you're like 99% in the clear of this being super effective. So with someone like myself who's had 2 out of 3 of my siblings having COVID, losing an aunt to COVID, hearing about my other peers in the field who are watching their patients die through a glass or losing their loved ones to COVID. And then they go to work and then they have to come home and see on social media that everything they're doing is a hoax. It's kind of a discredit to those who are sacrificing, but we need to look at it as, what is the problem now? This isn't an American issue. This is the entire world, guys. Like, this is the entire world where millions are dying and or suffering, and they don't even have access to the vaccine. We have a luxury of having a choice of 2 to close to 5 in a couple months. And there are those who they can't even touch it. So I just look at things and have people think of this as a global pandemic and not just, well, this happened in the 30s, and we're not going to downplay that at all, because I think a big issue with this is that we're not addressing the social injustices within the medical community that leads to this mistrust that honestly hasn't been addressed well enough among federal and state governments and public health boards. And it's a problem, and we're going to keep having this trust if it's not tackled. But when you put things in perspective, so many are dying in our communities. We already know that when you're talking about Latina, Native American, and Black communities, they're dying 3 to 4 times higher than white communities. So it is killing us. It's definitely killing my people as a minority, but we have to see it as, how are we going to get past this? And there is hope. And I want us to believe in the vaccine as a part of that hope, but we have to keep socially distancing, washing our hands, and wearing a mask.
Thank you, Dr. Canterbury. That was awesome. But thinking about, so we're talking about the vaccine, talking about what it is, the effects that will get it, the side effects that you may have if you get it, and the tracking. Like we know here in Arkansas is a rural state, and we have people, our citrus centers here in Little Rock, but we have people from all over, and then we have people all over on this call today, and they're wondering, like, well, what is the plan for distribution for the vaccine to where I live in rural Arkansas, or maybe, in an area that is under-resourced or underserved? What is the plan that the state has for getting the vaccines to us?
Well, let me talk about that a little bit. So this week in Arkansas, we received 37,125 doses to vaccinate new people. That doesn't count the doses we got for the second dose for other people. But for new people, we got 37,125 doses. And so if you do the math, that is less than 500 doses per county if you average it out. So we are clearly not getting enough vaccine to vaccinate the people who want to be vaccinated in Arkansas. So we're using a phased approach to vaccinate certain groups of people first. So in the beginning, we vaccinated the healthcare workers, starting with people who were working in hospitals taking care of COVID patients. And then we included the people working in the community healthcare workers. And then we also vaccinated people who work in long-term care, as well as the people who reside in long-term care, because that's the long-term care population that's had the highest death rate. Then we have moved to vaccinating people who are 70 older and people right now who work in education. So we've shifted a little bit. So that's caused where we send the doses to shift a little bit. And we have made a commitment to provide vaccine to every county of the state each week. It would be very efficient to have large scale vaccination drive-through clinics, for example. It wouldn't be as safe because you need to be observed for people, but say you had a large scale clinic, then you would have to have a lot of vaccine to do that. And it would be in the large population centers. So rural Arkansas would not get the vaccine they need. So we're trying to avoid doing that to the degree possible, because we want doses to go to every county, and even if it's just a few doses. We also have to take into consideration the characteristics of the vaccine. So the Pfizer vaccine can only go to places that have the special ultra low cold freezers. The minimum order for Pfizer is about 1,000 doses. Not every place can use 1,000 doses. So we're doing what we call a hub and spoke. We send it to some place with the freezer, and then they send it out to pharmacies in the community so that we have better widespread access. And then other counties get the Moderna vaccine, and the minimum order for it is 100 doses. So we can send that out to places that don't have as big a population and help them get some vaccine. And so that's what we're trying to do right now to make sure that everyone in Arkansas, all counties, have access to the vaccine. I wish I could say everyone has access, but that's not really true because we don't have enough vaccine for everyone. So right now it's going mostly to pharmacies in communities, as well as some hospitals and a few clinics, but not very many medical clinics. Over time, as the vaccine supply increases, we'll be sending it out to more pharmacies and more medical clinics. And then some of the hospitals through their affiliated clinics and some special larger vaccination efforts. So we've tried to set it up so that we can scale up quickly. And as soon as we have more vaccine, we have lots of people signed up, or lots of healthcare entities signed up to give vaccine as soon as we can get doses to them. So I think we're ready to go, but we are paying attention to rural Arkansas to make sure that all communities have access to the vaccine. We worked on healthcare workers. Now we're shifted to older adults. So we're looking at all, like this week, we looked at, for our doses this week, last week we looked at how many counties had less than 4% of the population vaccinated, and we gave them some extra doses. And how many counties, which counties had the highest number of older adults, people 70 older, we gave them some extra vaccine. So we're trying to make adjustments as we go along according to who the group is that we have priority for vaccinating. And now I'll say one more thing. A lot of places that have vaccine want you to sign up using the internet, you know, and that's a hardship for some people who either don't have internet access or don't have a smartphone or a computer. They don't have what they need to be able to sign up. So we are working to make sure that slots are available for people to get vaccinated so they can call in or access those appointments another way, that the people who don't have that kind of technology are not excluded. We want them to be included in the planning and the efforts to vaccinate.
I have a follow-up question to that. You said that the vaccines are being distributed to the counties. Once you get, who makes the decision on which pharmacies get the vaccine in the counties?
Okay. So in the beginning, we worked with independent pharmacies because they have more flexibility. And then we had pharmacists, we worked closely with the Arkansas Pharmacists Association, and there's networks of pharmacies that have, for example, one of the groups that we used was the Arkansas Community Pharmacist Enhanced Services Network. These pharmacies had a long history of working with vaccinations and having good quality improvement. You know, so we worked with groups that, or pharmacies that we knew had good experience vaccinating and were willing to take on the challenges and helping us work through our processes. You know, in the beginning, the pharmacies had to kind of figure out what worked in their community for them to receive the vaccine and give it in an efficient way without causing too much chaos. And they had to figure out how to make the appointments and get the word out without crashing their phone system. And so there were a lot of process things that are better now in a lot of areas. They figured out what works. They also had to learn how to report their doses efficiently because every dose that is given of COVID-19 vaccine must be entered into the state's immunization information system, which we call WebIZ, so that there's a permanent record of it. So they had to figure out what worked for them in terms of how to be able to enter that information efficiently, which is a requirement to be able to participate in this program. They're all getting better. And so this last week, of all the doses that were received, this new doses for first doses, they had given about 92% of the doses that were received in Arkansas were in somebody's arm within about 48 hours. So we're doing much better in that regard. In fact, now in terms of our proportion of population vaccinated, I think yesterday we ranked about 10th in the country of all the states. So I think we're doing good, but we're still, you know, working through our systems and trying to make it more efficient.
Working, make it more efficient. So we know how long the full round of shots will last, how long the effects will be of being the right word.
The duration of immunity?
Yes, ma'am.
So we don't know yet. It'll be interesting to find out that people who have participated in the drug trials are being followed, and we'll be testing people over time, checking to see their antibody levels and others markers of immunity. And it could be that eventually the immunity from the vaccines will wane and a booster dose will be recommended, but we're not there yet. Right now, it's just the primary series that's recommended, but we'll see over time. I think that the immunity will probably endure longer from the vaccine than it will from the natural infection. But so it might be a few years before we ever find out, you know, how much that it wanes.
Yeah, and I believe someone else may have touched on this in the questions about, will this be an ongoing vaccination you'll get every year? And kind of with the advent of seeing more new, I guess, virulent or virulent strains or mutant strains or whatever, variants is what they're calling them, it's likely that we'll probably, and we don't know this for sure, this is my opinion, it's possible that this will become more of an annual immunization. And for how long that lasts, we don't really know, honestly. We're hoping it lasts a while, but everyone is so different. And there are people who get, you know, the vaccine and may not have as strong as an effect as someone else. So we're still learning, and we're still trying to patiently share that information as soon as we get it.
So I have a really good friend who does not like getting injections at all. Like, and I've been with them, and they really cut up with getting an injection. Do y'all know of any studies where they're looking to see if there's going to be an oral way to feel, you know, to take away your whatever the right word is? Is there any oral?
Yeah. So right now, we're not even close to having an oral vaccine, but they are being worked on. And for people who are interested in it, the New York Times has a really good vaccine tracker. It's got all of the vaccines that are being developed around the world. If you just Google New York Times vaccine tracker, it will come up. It's just very interesting. And there are oral vaccines being developed, but not right now in the US. That's part of the big push right now. I do encourage people, if they don't like needles, to go ahead and get vaccinated, because if you get COVID-19 and you have to be in the hospital, you'll get a lot more needle sticks that way. So I encourage you, if you want to avoid needle sticks, be efficient and just get 1 or 2 sticks with the COVID-19 vaccines, and you can avoid all those sticks you'll get in the hospital.
I will say that most of the patients that I've administered the vaccine to, they will say that they didn't even feel it, or it just may have felt like just a little small pinch. And so we're not using just very long needles at all to administer the dose. So I think they would be fine. If they can endure a flu shot, then they can definitely endure this COVID vaccine.
Oh, this person struggles with the flu shot. But so this is the Faith Network, and I start off by saying that we've been talking to faith leaders about COVID-19 and how it's affected them and their ministry. Many of them are wondering what should they do and what can they say about getting vaccinated to their congregations and to other people in the community, because being the people on this call, people look up to them in their community and coming to them for input, like, Pastor, I'm worried about COVID. What should I do? Where should I go? Who can help me? So what are your suggestions for the faith leaders throughout our state on what they could do around COVID-19 and the vaccination?
One thing
start
we
that question off.
Go ahead, Dr.
No, you go ahead. You go ahead.
Okay, no, I was just gonna say that I just tell people, I give people my reasons for getting vaccinated, and I am a mother of 6 children. 5 of those children cannot receive the vaccine, and so my reason is to protect my family first and foremost, as well as my patients, and then people within my community. Especially those who are at a higher risk due to health issues such as diabetes, heart disease, and those morbid, I can't even talk right now, but those morbid conditions. And so I just want to make sure that I am protected, everybody. And so that is my reason. And I want to be protected from it myself as best as I can. And again, just with me personally having it and going through those symptoms, then I would much rather just deal with those side effects from the vaccine than to have to go through those symptoms again. So it's just making sure that I'm protecting my family, my patients, and my community, and encouraging others to do the same.
Absolutely. What I would say, and this is particularly one thing that we're doing on the Minority COVID Task Force here in Durham, is that we're partnering with faith-based leaders. We're working with churches. We're working with religious groups of other sects, like synagogues or Muslim communities. We're trying to reach out to different demographics, and this only is going to work if we have faith-based leaders partnering with these health clinics and nonprofits and getting the word out. So I highly advise you talk to your pastor as well about this, but you also want to talk to another medical source as well. Not everyone in the church is a medical expert. So be cognizant of that, but definitely the dialogue needs to just be open. And what we've done here in Durham is, with this collaboration, we've been able to serve on panels just like this within churches and have the webinars hosted through the church. So now we're reaching people where they're at with their faith. And then we're having a team of people just like here to really discuss how that may mesh with their faith and how does that, jive with their spirit. So faith-based leaders are really key and pivotal here in getting the word out and talking through these things. And they have the power to really convey the message that we did today. And that's really trying to keep people safe and protected with objective, good information.
Dr. Dillahay, do you have any suggestions?
Well, yes. It's been, this pandemic has been so hard on churches and other houses of worship. Some congregations are still not meeting in person, and every group has to make their own decision. I do want people to know that the Arkansas Department of Health has guidelines on our websites for how congregations can worship safely in person if they choose to do so. And we find that the congregations that follow these guidelines have seen very little, if any, spread of COVID-19 among their members. And churches that don't follow them see spread, and we really want to avoid that. So I'm hoping that the pastors and the leaders of our congregations, religious leaders, can set the example for how we wear our masks, keep a safe distance, avoid large groups, and so forth, so that we can, be good stewards of the resources that God has given us and the people that we interact with. And then when the vaccine is available, to encourage people to take advantage of this. I really think that these vaccines are truly a gift, and they've been given to us as a way to promote health and wholeness, well-being among all people. And, there's nothing to me that shows love more than that. And to me, it all boils down to what is the loving thing to do. And I think if we can focus on that, then we can make a big impact. And it's the leaders of our houses of worship, our congregations, that are the models that we need to follow. What shows love?
That's great. Thank you all for that. Well, Dr. Dillahay said, we're asking, faith leaders to just be positive role models of the things to do. If you need support in that, the Faith Network actually has some toolkits available that has signage for your place of worship that has on there, this is how you wear your mask. Please stay 6 feet apart. If you need one of those, just reach out to us, and we will get that to you, mail you that. It is free. We also have some masks available. And so we just request that. We'll get to you what we can. We can't fulfill, exactly what you may want or need, but we can provide you with a little bit of what we have. Are there any last comments that any of our panelists would like to make? Well, I thank each of you for taking time, for being with us today. Of our panelists, you all were awesome. This was a great discussion. I apologize if we missed any questions in the chat. We will try to follow up with us, and we'll try to get those answers for you. And to everyone that's logged on today, thank you for being here. If there is anything that you need, feel free to reach out to us at the Faith Network. If you want to set up something with your church to get information about the COVID-19 vaccination style, reach out to us and we can try to assist any way that we can. We are here to support you and to work together and connect together. With that said, you all have a great and wonderful day, and I hope to see you at the next Lunch and Learn. We don't have one next month. I know we have one planned for March, and it will be on, let me not say what it's on. We'll get that out to you, but we do have one planned for March.
And one thing I'll just add is, if you have any questions, I think it's important that we just keep the dialogue going. If you want to reach out to me, you can definitely reach out to the Faith Network and get my contact just to talk about anything on the side. Or any questions you may have had today, I'll be happy to address that too. I'm just going to go ahead and put my cell phone in case you just want to text me anything. Not a problem. Okay?
Thank you, everybody. Y'all have a great day.
Thank you.